When a fallopian tube becomes a problem, why doctors may recommend tubal removal. Many women become worried when they hear the word your fallopian tube may need to be removed. But here is important truth. Removing a badly damaged fallopian tube is sometimes done to protect your health, improve fertility planning, and increase the chances of IVF success. Good day. I'm Dr. J.E. Muloi from Joburg Fertility Center. Today we are discussing an important fertility topic, why a fallopian tube may need to be removed and when this procedure may be recommended. The operation to remove a fallopian tube is called salpingectomy. When it's done through a small key cut, it is called laparoscopic salpingectomy. The fallopian tubes are important because they help the egg and the sperm meet. They also help the early embryo travel into the uterus. However, a fallopian tube can become damaged and may stop working normally. When this happens, it may reduce the chances of pregnancy or even create healthy risk. One common reason for removing a tube is hydrosalpinx. This means the tube is blocked, swollen, and filled with fluid. This fluid can flow back into the uterus and may affect the embryo implantation, especially before IVF treatment. Another reason is previous or current ectopic pregnancy, where a pregnancy develops inside the fallopian tube instead of the uterus. If the tube is badly damaged, removing it may be necessary to protect the patient. A tube may also need to be removed because of severe infection, repeated pelvic inflammatory disease, endometriosis, adhesions, chronic pelvic pain, or severe scarring after previous surgery. Sometimes the tube is so damaged that it cannot transport the egg properly. In such cases, keeping the tube may not help fertility and may instead reduce the chances of successful treatment. For patient planning IVF, removing or blocking a damaged tube may improve the womb environment before embryo transfer. The goal is to create the best possible chance for implantation. A common question is, can I still fall pregnant after one tube is removed? The answer is yes. Pregnancy may still be possible if one tube is healthy and the ovaries are functioning and the sperm results are normal. If both tubes are removed, natural pregnancy is usually not possible, but IVF can still help because fertilization happens in the laboratory and the embryo is transferred directly into the uterus. Removing a fallopian tube is not done without reason. It is recommended only when the tube is causing problems, increasing risk, or reducing the chances of pregnancy. Individually, before recommending surgery, we consider age, ovarian reserve, ultrasound findings, HCOC results, semen analysis, symptoms, and future fertility goals. If you have blocked tubes, hydrosalpinx, previous ectopic pregnancy, endometriosis, pelvic infection, pelvic pain, or difficulty falling pregnant, book your fertility consultation today. Joburg Fertility Center, giving hope, restoring possibility, and walking the journey to parenthood with you. Together, we can achieve our goals. Thank you, thank you, thank you.